Hello and welcome, everyone. Thank you so much for joining us today for our interesting interview on Psychiatric Advance Directives. My name is Sucharita Sensomkuar. I am the CNS, Medical Science Liaison for Southern California, Nevada, and Idaho. And I'm joined here today with Dr. Leon Ravin. Thank you, Dr. Ravin, for joining us. Dr. Ravin is the psychiatrist and statewide psychiatric medical director for the Division of Public and Behavioral Health for the state of Nevada. He's an expert in general adult and forensic psychiatry and serves as the clinical professor at University of Nevada, Las Vegas School of Medicine. Dr. Ravin also serves on the executive committee of the Medical Directors Council on the National Association of State Mental Health Program Directors, and on the LAI work group for SMI Adviser, which is an APA and SAMHSA initiative, and on the conference for the Committee for the National Psychopharmacology Update, the largest psychopharmacology conference in the United States. Dr. Ravin's interests include delivery of psychiatric care, mental health laws, and medical ethics. He's one of the lead trainers for the Crisis Intervention Team, or CIT, training for Las Vegas Metropolitan Police Department. So before we launch into the interview, just wanted to quickly lay the rules of the road ahead for us. So this program is presented to you by PsyQ. PsyQ is an informational hub and a community of mental health care professionals, including but not limited to physicians, psychiatrists, nurse practitioners, physician's assistant, and other mental health care professionals, and is dedicated to improving the future of mental health care through information, discussion, and collaboration. PsyQ is supported by Otsuka Pharmaceuticals Development and Commercialization. It is also supported by Otsuka America Pharmaceuticals and Lundbeck LLC. They are committed supporters of the mental health care treatment community, and the opinions expressed by PsyQ's contributors, so in this situation, myself and Dr. Ravin, are our own and are not endorsed or recommended by PsyQ, its sponsors, or the affiliated organizations for our speakers. The information provided through PsyQ is intended for the educational benefit of mental health care professionals and others who support the mental health care community. It is not intended as, nor is a substitute for medical care, advice, or professional diagnosis. Users seeking medical advice should consult with healthcare professionals. No CME or CEU credits are available through any of the resources provided on PsyQ. And our contributors may be paid consultants of OPDC, OAPI, or Lundbeck LLC. So without further ado, welcome Dr. Ravin. Thank you for joining us today for this very important and timely discussion on the topic of psychiatric advance directives.
Thank you, Sucharita, for welcoming me, and thank you, PsyQ, for hosting this event. I am thrilled to be here. I have been passionate about psychiatric advance directives for many years, and I'm just excited for having the opportunity to be here and discuss that with you and with the audience. I would like to make it clear that in spite of the lengthy list of titles that you gave early on, today I am not speaking in my official capacity for any of the mentioned institutions, and I'm here just as a psychiatrist who is passionate about psychiatric advance directives.
Thank you, Dr. Ravin. So, Dr. Ravin, the first question that we have is, could you give us an overview of what is a psychiatric advance directive or PAD?
So, psychiatric advance directives is a relatively new concept. It only has been around for a little more than um, 20 years or so. And more states, since the first laws being enacted, started adopting that tool for the purpose of serving of their citizens. In general, Psychiatric Advance Directives is a legal tool that allows a person with mental illness to state in advance their preferences for psychiatric care. The document that they complete, they can complete it themselves, or they could ask for help a peer or a professional. In this document, they can state what care they would or would not like to receive in case of mental health crisis when their decision-making capacity is impaired. Additionally, a person with mental illness can appoint another competent adult who can make healthcare decisions on their behalf when the individual is no longer able to make those kind of decisions.
Thank you for that brief overview. I just had a question before we move forward. I just want to know from our audience perspective, who would benefit from having a psychiatric advance directive? So, who is the person who should, look into psychiatric advance directives?
This is a really good question. In generally, anybody can complete psychiatric advance directives. However, the people who could benefit the most are the ones who had the most experience with mental health treatment, particularly if they had instances of requiring emergency care or inpatient psychiatric hospitalizations. These people can draw on their experience and remember what worked, what did not work for them at the time of crisis, and be able to convey that knowledge to their treatment team. The research tells us that the patients are well informed about evidence-based and low-cost treatment interventions. As a matter of fact, in the studies that were designed to assess the knowledge of patients with severe mental illness about treatment options, in 95% of the time or more, treatment recommendations or preferences that our patients wrote down the were rated by healthcare professionals as feasible, useful, and consistent with the standards of practice.
That is really good to know that our patients have good insights that they can share with the treatment team that the treatment team then values. Dr. Ravin, can you share your experience when not having a psychiatric advance directive affected your patient care?
We see this in daily practice. We have many patients who get admitted to a psychiatric facility and they're in acute mental health crisis. They have history of prior psychiatric inpatient hospitalizations. And when they present acutely ill, they're not in the best position to fully appreciate the severity of their symptoms, understand the risk of potentially leaving those symptoms untreated adequately, and that they are not able to fully thoughtfully reflect on all the good and bad things that they experienced in prior treatment episodes. On many occasions, that can contribute to delays in care and selecting care that may not be the most optimal for patient. We also have situations when the patients are unable to consent for care at the time when they are admitted onto a psychiatric facility due to severity of their symptoms. And in this case, the hospitals have to go to the court asking for court-ordered treatment. In such cases, that process can play out over a period of days or even weeks, and not only contributes to delaying care the patients needs, leaving them suffering from symptoms of acute mental illness. But even at the end of the day, when the court approves treatment for the patient, it still may not necessarily be the treatment that fully accounts for patient preferences.
Thank you for sharing that experience. And clearly, there are so many advantages, so many scenarios in which having that psychiatric advance directive would definitely make things more streamlined and faster for the patient and their patient care themselves.